look at are the patellar special test. Essentially the one that you have on there, which is the eccentric step down, is the same as what we're doing from ClinEd 2. All right, now what we did do is we kept the heel down, and for ClinEd 2 I said go down to your toe tap, just touch the toe down, so that you can start to get a sense before they go into full range. To fully clear out from a perspective of patellofemoral tracking issues, they should be able to get their heel all the way down. Okay? If you make them keep their heel on the step down, the stepping foot. We started with toe tap, so progress it all the way to getting the heel all the way down, so you fully clear out patellofemoral issues. You're looking for the same thing you're looking for with your movement assessment, if they're deviating, but also if they're inducing patellofemoral symptoms. Okay? Keep the heel down, this way you can get a good sense of what's happening in the ankle of the foot that's standing on the step. Okay, so considered a special test, but it's a movement assessment. Okay. So the other is we're looking at stressing the patella to see if you induce symptoms. So there is the patellar apprehension test where you're pushing the patella laterally and waiting for the patient to be like, oh, I'm not so happy with that. I don't like this test because I never like pushing the patella laterally. So if you do it, you're doing it very gently and you're really listening for the symptoms. All right? If someone has that laxity, you don't want to feed into the laxity of pushing that laterally. Okay? The other test that's known is the Clark's test. Now this is a pain provocation test, but you can feel crepitus. It can be a painful test. So essentially what this test is you're trying to grind the patella. So it seems like not such a nice test. But what you do is you take the web space of your hand and you place it just above the patella and you put a little bit of pressure down on the quadriceps. You okay with that pressure? Yeah. Okay. Now, I do it with very minimal pressure. And I also will palpate the patella. Because if as you add the compression and they contract the quads, you feel the grinding in the patella, that could be an indication of some wear and tear happening in the patella. So I just put a little bit of pressure down like this. You okay with that pressure? And now just tighten your quads for me. Just fully tighten, tighten, tighten. You okay there? Okay, and down. So no symptoms, so now I can go a little firmer, all right, to really try and rule it out. You okay with that pressure? Okay, and now go ahead and tighten the quads. Ow? Okay, and come back. All right, so that's a positive. And so if they can't fully tighten the quads and they have pain, then they're reacting in the patella. You okay with pressure there? Okay, now tighten the quads here. Is that okay? Okay. Pressure. No? Okay. All right. So it's not the best test in the world because putting pressure through the patella and then asking them to contract is likely to induce symptoms. But it is a popularly known test, so similar to the pivot shift test. I want you to be familiar with these tests that people are talking about or some people are doing. Whether or not you actually do it, that's up to your own clinical judgment. Okay?
So you pretty much perform it twice, huh? Like
if I'm going to do it, I do it really light because you can see, I mean, do you have patellofemoral issues? No. So even with people who don't have patellofemoral issues, when you put a lot of pressure, they're going to be painful. So if you just dive down on it and the person doesn't really know what to expect and they just contract really hard, it's pretty painful, and then they're like, why did you do that to me? So I do it very light just to kind of get a sense of it and then load it up after that. Yeah. Okay. Those are the patellar tests, so I'll go through the joint glides as well, and then I'll talk you through it as you guys do it on your partner. Okay.
What about the plica? We have plica.
Oh, plica test. Whoops, forgot that on there. Yes, okay, so your plica test, so that one comes up. You could actually do it sitting, you can do it even this way. What you're going to do is you're going to medially glide the patella just to create some space. Because you have that plica. We did that when we did the palpation lab. We palpated the location of the plica, and that plica is just the normal fold in the synovium of the joint capsule. So essentially, what you want to feel is if it's painful, if it's snapping and painful. So if you move the patella medially, just kind of gives you a little space to get in there on the medial femoral condyle, and you're palpating just superior to the medial femoral condyle, feeling for that little fold of the synovium that gives you that snapping. And then what you say is go ahead and straighten your knee. And down. And nothing there. Sore. Straighten. And down. If you do it off the edge of the bed, go ahead and swing your legs around. You get that full knee extension. or a more neat flexion, I should say. Medial glide, the zoom effect. Okay, bend the knee, bend the knee. Okay, go ahead and straighten the knee, and bend the knee. Yeah, so nothing.
Ah.
Ooh, really?
Yeah.
Oh. All right, do it again. Down.
Right there where you're pushing.
Right where I'm pushing?
Mm-hmm.
Okay. All right, so a little sensitive. I didn't feel the snapping because when you rub over it, you can feel that snap of the plica, and I didn't get that. But we have a little sensitivity in the knee going on here, but no functional symptoms or no symptoms in function. But that's your plica test. Yep.
What diagnosis does the Clark sign show?
So it's a sign of patellofemoral issues or chondromalacia patella. So chondromalacia patella literally being painful cartilage. So when you compress it and they contract and the cartilage is painful, that's your chondromalacia patella.
So, you were saying that you would slide the patella medially. And the slide is saying both laterally and medially.
Yeah.
Which one do you?
I don't ever slide patellas laterally, but as I mentioned, I tend to work with a hypermobile population, so that's been my adaptation in the clinic. So the thought is if you do pull it laterally, you're uncovering the area, but if you shift it medially and you hug underneath the patella, then you're able to get directly to the plica.
And when you're talking about when you shift immediately, you're hugging on the lateral side or still hugging?
No. The plica is on the medial side.
Okay.
So you're palpating the medial condyle, the femur. When you glide it medially, it's just you're creating a little shelf so you can get underneath it, so you can get right to the